So, okay, when we ask that question, that important question regarding whether we should withdraw, also withhold or withdraw life-saving treatment, then we sort of ask ourselves one question. And remember, we talked about the state of the patient, and then we also talk about whether treatment will is life-saving or not. So those are the two components that we're really looking at. So the first kind of question we need to ask ourselves is death or diminished neurological state imminent with high probability? So when we talk about these nuanced concepts, such as death and diminished neurological state, and we talk about high probability, so a death or diminished neurological state, depending on your take on this issue and which ulama you are, you're taking your advice from, this may relate to cardiorespiratory or neurological criteria for death. It may also include states of permanent unconsciousness or PVS or MCS. Okay, so a persistent vegetative state or minimally conscious state. We'll talk a bit about them later on. So that's the kind of question you need to ask yourself. Is that imminent with this particular patient in the current state that they're in? And then the other question that you ask is the treatment offered. And if the answer to that is no, then reality is that in that sense, it does not become obligatory for you to now start this particular or withhold or not to withhold and not to withdraw life-saving treatment in these patients, because there is no imminent risk of death, and that has to be of some high probability. If not, then clearly we look at other factors such as compounding harms. If yes, then the question then arises, oh, right, okay, so this is the situation. This person is going to die if you don't do something about it. So the question now arises, the treatment that we're offering, will that rescue this patient with a high probability? And these questions are important. So we need to ask that question. The life-sustaining treatment, life-saving treatment that we're offering this patient, is that going to rescue this patient with a high probability? And if the answer to that is yes, then taking into consideration the balance of harms and benefits that we talked about, compounding harms in the previous session, bearing that and balancing that out, you may come to the conclusion that the benefits equal or outweigh the harms. So if they are such, then the argument is there that it's obligatory. So to initiate or continue treatment. So not to withhold and not to withdraw. So the question now arises, if not, so there is no high probability in terms of that being a life-sustaining treatment for this particular patient, then again, you look at any other compounding harms. And if the harms outweigh benefits, then it may actually be obligatory for you to withhold or withdraw treatment because it's harmful for them. And if it doesn't, so benefits are equal or outweigh harms. So this is another interesting point, because here we have a situation again where the benefits clearly are still there. Then it may be recommended, highly recommended, but it would not be obligatory to the degree where it'd be sinful for the patient and themselves not to accept it. And clearly, if the patient doesn't have capacity for that family, and also as a morally thinking clinician, a Muslim clinician, whether it would be the right thing for them to do or be a participant in withholding or withdrawing life-sustaining treatment.